Medfit Rehab founder Joanne James is a medical exercise specialist. Medfit Rehab, restoring strength and movement, making a difference in people's lives. 647-259-5481. Columbus Center, Athletic Department, Dufferin and Lawrence, medfitrehab.com. Is staying healthy becoming too expensive with personal trainers, gym memberships, massages, and supplements? Then Joanne James, medical exercise specialist, and her dedicated team have exciting news for you. Imagine a healthcare plan that saves you money on personal and group training and gives you premium access to medical professionals. That's what Medfit Rehab can offer you. In the Columbus Center, Dufferin and Lawrence, call today to learn more. 647-259-5481, medfitrehab.com. Hi, Joanne. You know you're following an admiral.
Fantastic. I'm impressed and I'm honored.
Okay. I want to know why everybody needs, I do understand why everybody needs a physical assessment, but why do so few people understand that?
I guess because maybe they're not even asked if they should do one. They're not educated in terms of understanding the importance of an assessment. They're usually just more motivated to let's just get going. If they understood how the assessment could be motivating, could help them set their goals, could keep them on track, I think more people would ask for an assessment first, because that's very key to have an idea of where you're starting so that when you are training or exercising for a while, you know whether your program is actually giving you the results that you're looking for.
Well, you're absolutely right, but the point is it's very hard to twist people's arm. It's very hard to say the best thing that ever happened is getting an assessment, because then you know how to go forward. Otherwise, you see people on the gym floor making such mistakes and probably injuring themselves in the process.
Well, and that's very true. Now, at Medfit, one of the reasons we do the assessment, one is, yes, to be able to set a mark for where people should start. But we also do the assessment to screen out individuals to assist them in helping them choose which activities would be best for them. So if you have a chronic illness, but you say you want to jog, you want to do plyometric type exercises, you want to climb Mount Everest, well, we may want to inform you as to whether that is a really good idea or not. And or we may say, look, you need very specific training for that. We can set that up for you so that you can actually achieve what your goals are. So the bottom line is the assessment helps us to determine whether a person should be doing a particular activity or whether we should be recommending something that would be far more safer or far more effective for them. And that's just the basic assessment. And that we're looking at upper body strength through planks and push-ups. We're looking at core strength through planks and abdominal exercise. We're also looking at flexibility, range of flexibility. But we also have an added feature to our assessments that we do musculoskeletal assessments to assess the joint strength, their flexibility, and, whether we need to be implementing programs specific to that. We're looking for back issues, knee issues, any kind of joint issue that can be impacted on by exercise. So our assessments are 2 to 3 tier. And then if we find out that you do have a problem with your back or your knee, we go into regional assessments that dive into those specific issues that you have with your knee, your back, or any joint on your body. So, yes, you have a standard assessment, but we at Medfit tend to go beyond that into a more detailed assessment so you get a better picture of where you're at and what you should be doing.
And how do you plan the program for people? Go ahead.
Yeah, no, once we get that assessment, we know exactly where that person's at. Then we sit down with them and we find out what are your ultimate goals. Is it because you want to achieve something in a certain period of time, or is it you want to be ready for a wedding? What is it that you're looking to do? We have people that say, I want to be able to play with my grandchildren. We have other people that say, I'm a professional water skier and I need to be strong and have the endurance that my sport requires. So even though we have the assessment, we still need to find out what that individual needs and wants. And then because we've done already a medical history on them, we'll know what they can and can't achieve, what they can and can do. And with their goals, we then design the program. Because you can't design a program unless you have all that other information, or else it's just a general program. It's a hit-and-miss program, really.
Well, I think that it's very important for people to understand that they need the proper guidance, and you need it from a medical professional, regardless of whether you think you're in great shape or not, because you never know.
Well, and that's what we found out in the assessments, and that's what our clients have found out. That maybe they were very poor in one area, but strong in another area. And another added component to the assessments that we do is that we actually send not necessarily the assessments, but the reports of their program and how the client is doing to the doctor, if the doctor is interested in knowing how well they're doing. It also gives the doctor an idea of what that person is doing. We have a person that just started that said that their doctor is going to be putting them on a cholesterol medication in 3 months if they don't get their act together in terms of exercising and eating correctly. That person was running scared. We're working with them because our goal, number one goal, is to get their cholesterol level down with the assistance of that client. And so we did an assessment, we found out what their needs and goals were, and now we have a focus for their program as well as an overall general conditioning program for them.
We're going to talk again tomorrow. Thank you very much for joining us. Wonderful information. Give Medfit a call today. Thank you, Joanne. Have a good day.
Thank you, Zelda.
Bye.
Have a great day.
Joanne James, founder and medical exercise specialist of Medfit Rehab, will improve your overall health through medical exercise. Contact Joanne James, 647-259-5481, Columbus Center Athletic Department, Dufferin and Lawrence, medfitrehab.com.